Well, well, well. Look who I see.
And we are back. I'm very sorry and apologize, everybody. Technical difficulties happening in this moment, but we are back and going ahead with the U equals U and its perspective after 40 years at the HIV epidemic in the United States. Welcome, everybody. My name is Luis Alberto Mares. I'm the Director of Mobilizations and the Commissioner on AIDS. And I'm very glad to have this webinar today with us because I carry this message in my heart. I'm part of the U equals U ambassador team, and I'm having these two amazing women today with me. They are also ambassadors, and one of them even worked for the campaign directly, and they will explain to us about U equals U, what it means, and the importance of U equals U these days, and how we can use the message for a variety of reasons within the aspect of HIV, stigma, HIV, criminalization, many other things that you're going to find very, very interesting. So because of the problems, we're going to go ahead now. And Davina and Maria, you're welcome. Thank you very much. And we love you.
Thank you, Luis. Thank you. So I'll start again. I am Dee Connor. I am the Creative Engagement Outreach Specialist for Prevention Access Campaign, and Maria Mejia, proud ambassador of Prevention Access Campaign. We're here today to talk to you guys about 40 years of the HIV epidemic, U equals U perspective, and we want to thank the Commission, Latino Commission on AIDS, for inviting us today. So we'll get started. Next slide. So undetectable, untransmittable. It means a person who is on treatment and has an undetectable viral load cannot transmit HIV to their sexual partner. That is zero risk, you guys. Remember that, zero risk. Next slide. And this is a defining moment in history in 2016 when U equals U came to light around the world. Next slide. So why is U equals U a game changer? First of all, it transforms sexual and social reproductive lives of people who live with HIV. It dismantles the HIV stigma on the person who lives with HIV, clinical settings, community, and policy levels. And this is happening now. It's changing the lives of people with HIV, especially internally when they hear the message U equals U. And then we talk about their treatment goals. So it reduces anxiety associated with testing and adds an incentive to start and stay on treatment. That is happening right now. When people hear U equals U, they want to get back into care. It's helping people get tested now. U equals U is changing so many lives. And then our universal access. So it provides a strong rationale to increase access and eliminate barriers to treatment and diagnostic. And Prevention Access Campaign has a third U, which is called U equals universal. Next slide. And Maria, before I go to the next slide, so let everybody know why U equals U is a game changer to you. Why is it a game changer to you?
Yes, well, first of all, my name is Maria Mejia, as Dee said, my wonderful sister in the fight. I'm a 33-year long-term survivor of HIV. So I've kind of been through almost all the phases of living with this human condition. Why is U equals U a game changer to me and to the community that I serve, especially dedicating this to Latinx Awareness Day on HIV and AIDS and the whole month, basically, because it set us free. It set us free from stigma, from self-stigma, it made us more adherent. It made it easier for people to disclose and for us to fight governments that are not giving people access to treatment. By showing them the scientific facts, we're able to change change many minds and make them understand that they cannot continue to gatekeep this information. And that's why it has been a game changer.
Thank you, Maria. Thank you. Next slide. And then U equals U guidelines, treatment, labs, excuse me, and care. So people who live with HIV, we need all three of these to save our lives. Treatment, labs, and care is to save our lives. Next slide, please. So U equals U guidelines again, under 200 copies. Remember that, it's under 200 copies. It's about sex, you guys, it's about sex. U equals U is about sex. And we have to remember that there are other STIs and there can be pregnancies. So we may want to use the condom. Next slide. Prevention Access Campaign, U equals U, is now a global organization. We have over 1,050 partners in over 100 countries since 2016. That is so amazing. It happened so fast, but it's amazing. Next slide. And we'll talk about our global endorsements here. Next slide. So U equals U education is a minimum program requirement now. PEPFAR in all PEPFAR countries. Next slide. And then United Nations, they talk about U equals U for the first time in their policy declaration on HIV/AIDS. Next slide. And then the World Health Organization, they have U equals U in their policy guidelines now. Come on, you guys. U equals U is everywhere. Next slide. And this here, so ViiV did a study, and the study was done with over 2,000 people who live with HIV. It's one of the largest studies to date, and it was in 25 countries. Come to find out that the health outcomes of people who live with HIV, who were told by their healthcare providers, they had better overall health, mental health, sexual health, viral suppression, and now they're comfortable with sharing their HIV status. Next slide. And this is also part of the study from ViiV. And it just gives you the percentage of everything when people with HIV are told about the outcomes of U equals, told about U equals U from their healthcare providers. And they're two times, you guys, more likely to stay at viral suppression. But we have to remember that 1 in 3 people do not know, they're unaware about U equals U. Next slide. U equals U is the foundation of ending the epidemic. And this is what Dr. Fauci said. Let's play this.
And so you talked a little bit about treatment and using it as prevention, or U equals U, as a lot of people know the phenomenon. Is that one of the tools that you'll be using, rolling out?
U equals U is the hallmark of what we're doing, because if you can get the infection level, the viral load in any given individual to below detectable, that person will not transmit infection. That means U equals U. So if we accomplish U equals U, if you think for a moment, what does that mean? That means we don't have anybody that's transmitting infection. So that's what I mean when I say that concept of U equals U is the foundation of being able to end the epidemic.
And so
Now, I have a question for Maria that I need to ask. So Maria, talk to everybody and let them know, why do you feel it's important for our healthcare providers to talk to us, to talk to people living with HIV about U equals U?
Well, because is the ethical thing to do as a doctor? Because when you gatekeep and you don't give a human being that's with a condition like HIV or cancer or anything, you don't give them every part of the information, the good, the bad, and the ugly, as I've always said, you're not being an ethical doctor. by the doctors giving this information to their patients, the patient is going to be not only, especially in these times, more calm and see more, not feel so hopeless how we all go through in the beginning. And is going to give them what I explained in the beginning, you know, better adherence, disclosure, which is so important, you know, it helps stigma, this internalized stigma and the things that we talked about in the beginning. So it is their duty as doctors to give their patients accurate information, period.
No, you are so right. It is their duty. It is their
It
duty.
is their duty, of
Yes.
course.
So
Yeah.
let's talk about the #2 medical journal in the world. So they have a U=U call to action for ending the epidemic, and it's prioritizing treatment to get people into care so that we can end the epidemic. There's one here. Healthcare professionals need to inform patients living with HIV and affected by HIV about U=U. Next slide. They also say that providers, they have a call to action for providers, advocates for use of the concept of undetectable equals untransmittable. This is so important because once you talk about U=U, it helps people, like it says here, to remain and become virally suppressed and remain that way. Next slide. Another one for advocates, you guys. So advocates should be equipped. We should be equipped to use the so-called public health argument from an advocacy standpoint about U=U. You know, this is about the health and the well-being of people who live with HIV. And if the #2 medical journal is telling people this, we should be listening to it. It's about the science, you guys. You have to believe in the science. Next slide. It's a natural, culturally competent effort is needed to raise awareness of U=U. You know, just the approach to reduce the stigma and the internal stigma, like Maria said, when it comes to living with HIV. This is part of the goal, you guys. It's part of the goal. And to get people back into care. We gotta get people back into care. Next slide. So the CDC had a model, had a model and still has this model from December 2020. And it's the same thing, it states prioritizing treatment to get as many people into care by 2030. And they talk about this can end the epidemic. I believe it. I believe if we can get as many people back into care, it will eliminate the transmissions of HIV. Next slide. Successful U=U implementation. So communication, promote accurate and meaningful conversations when it comes to U=U. Talking about it from the healthcare providers talking about it, from everybody talking about it, not just people who live with HIV, but also people who are HIV negative. HIV affects everyone. It affects people who are negative. It affects people who are HIV positive. Next slide. So communication, so speak clearly, confidently, consistently, and consciously when it comes to U=U. And these are the 4 C's, but we also, the 4 C's of U=U and Prevention Access Campaign. So we also have to remember, not everyone can reach undetectable. So we have to make it where it's not about people who only reach undetectable. We can't leave anyone behind when it comes to U=U. We have to remember that. People who are HIV positive and undetectable, we are no better than the person who is not undetectable. Next slide. So let's be clear about U=U, guys. This is what you say, and this is what you don't say. You know, negligible. You don't say that. You say pass it on. You can't pass on HIV, because remember that language, words have power and they mean a lot. It's the way you convey things when you speak. So extremely unlikely. Say can't pass it on. Virtually impossible. There is no risk at all. Zero. We said that earlier. Close to zero, zero risk. Helps prevent. Nope, it prevents HIV. U equals U. Can't pass it on. We can't transmit. There is no risk, zero risk, and it does prevent HIV. Next slide. Maria, you're going to take it away.
Ok, bueno, aquí voy a hablar de indetectable equivalente transmisible. Hoy en el día, bueno, no hoy, el mes de el Día Nacional aquí en los Estados Unidos para la comunidad Latinx en cuanto al VIH y SIDA. Here in the slides we see campaigns that were done in our language, in the Latinx Spanish language, which is my language. I'm from it. I was born in Medellin, Colombia, and as I said in the beginning, I'm a proud 33-year long-term survivor, and I've been in this fight for a long time, and just seeing these campaigns and just seeing it in my language was so important. For example, I was one of the first people. Well, I was the first person that took it to Colombia. You know, gave a presentation there, and you know, there's a lot of things that I will talk about a little bit in a little bit about, you know, the aggression that I received with this information, but you cannot go against science and against studies.
Next slide, next slide. Okay, Maria.
Again, more campaigns from the Latinx community in the United States and Latin America. It's very important for the Latinx community to have materials in Spanish. And that's how it's been globally, because there's campaigns that for U equals U, Indetectable Untransmittable, that are from all over the world, all continents. That is very important, at least for me, to see all of this, para ver esas cosas tan importantes como nuestro lenguaje, que es tan importante porque no todo el mundo sabe inglés. Fue muy difícil que la información llegara a las comunidades en Latinoamérica y hasta en España, inclusive de médicos, pero logramos que entendieran que nadie puede ir en contra de la ciencia, y esto nos ha liberado del estigma y de muchas cosas más.
Okay.
I love it, Maria, in Spanish.
Thank you, Maria. Thank you.
In both languages, because I am a Latinx number one.
Next slide. Oh, thank you.
I know there weren't questions and answers, but I guess that I didn't realize that we had passed slide 24. And I'll take this time to kind of go quickly through the history of my history with U equals U, and then the beginning. In the beginning was 2016. I remember this man online on Facebook crying and passionate. And I'm like, oh my God, who is this man? And he's so handsome too. And I could relate because I am a very passionate human being as well. And I'm a fighter. So I identify with him immediately. And I'm like, we already knew about this because of the Swiss statement.
Right.
But as the ambassador, I was unable to give a statement that was not already backed up by at least the NIH or the CDC, because I have a huge responsibility, not only in the United States, but all over the world for the people that follow me. There's people that follow me that take my advice more than their own doctors. And I'm not a doctor, as I tell them, but they see me as their example. So I waited for a year. Like I told Bruce, I observed everything. And after you see the studies, like the partner study, with how much is it, 58,000 sexual acts with a person that is positive and the other one that is negative, and not even one transmission when the person is undetectable, you can't go against that. When I gave the presentation in Colombia, I had 4 doctors in the front ready to basically cremate me. and go, but as I mentioned from the beginning, the presentation, I said, I'm not a doctor, I'm not a scientist. I'm here to give the accurate information that you see here. That is a scientific facts and studies. So it's not my belief is science. And at the end of the day, you just had to understand it. I received a lot of insults. I know that did as well sadly from sometimes our own community, even of long-term survivors, saying that we have blood in our hands, that we were giving inaccurate information. So basically in 2017, I joined the National and International Steering Committee for U equals U, and I started giving the information. I didn't care who attacked me because I had science backing me up. So why is U equals U important? ¿Por qué es indetectable e intransmisible importante? How is it impacting, and what I have observed, the Latinx community in the United States? It has helped them with adherence. It's helped them, again, like I said, with disclosure, with getting tested, and with the stigma that is even more horrible in our Latin American countries, because we're ruled by religion, mostly by the Catholic religion, where they say that this is a moral condition, that it is a punishment from God, and that is horrible to me. So not only do the healthcare providers have the duty to tell their patients the truth, but also our spiritual leaders that influence our culture, Marianismo, machismo, all of that.
Right.
Cannot go against that. And after the facts are there, and after all the studies were there, and after the CDC made this statement, I said, oh, now they cannot go against me. Then the NIH without Dr. Fauci, then the United Nations. It made me very sad, though, when they made the statement in 2017 with the head scientist of the United Nations and Dr. Fauci and Dr. Charles King, which is a good friend of mine as well, and the doctor that did this statement, because we knew about this already. He said, why did you keep this information from people living with HIV? And the response was, because we didn't believe that they were responsible enough. Now you see that's when I went and made a live on my Facebook and all over.
Right.
I was upset because I had my partner. I had to live for years and years thinking that I could transmit this condition to another person. And that is not right. So I said to them that they did a disservice to us, because I know for a fact, and this is facts, because people write me all the time, hundreds and hundreds of messages all over social media telling me, I'm undetectable, Maria. Now do I have hope? Now I'm disclosing easier because now I tell them, look, I have HIV, but I cannot transmit it because I'm undetectable. And if they don't believe it, like I say, send them to Google to see.
Right. Yeah.
Undetectable equals untransmittable. Rápidamente voy a decir lo que dije en inglés ahora. ¿Por qué indetectable e intransmisible es importante? Porque nos ha liberado, me ha liberado a mí, pues como persona que vive con estas condiciones de 33 años. Ha vuelto a las personas más adherentes al tratamiento porque quieren ser indetectables para no transmitir esta condición a nadie. ¿Quién quiere transmitir esto? Ha ayudado con el hacerse los exámenes del VIH porque ya no tienen miedo, porque saben que pueden tomar su medicamento, volverse indetectables y no transmitir el virus. Y para lo que decía el día ahora, de las personas que son detectables, yo tuve esa experiencia por 10 años, yo fui detectable por 10 años en Colombia, donde en la época esa no había nada, no había medicina, no había ejemplos, no había medios sociales, no había nada. Entonces cuando la gente me atacaba ahí, todavía, María, estás poniendo como si fueran leprosos a las personas que están detectables. Yo le dije, yo fui detectable 10 años. Y la gente en Venezuela, por ejemplo, donde luchamos para que ese comunista le dé el medicamento a las personas en Venezuela y en otras partes del mundo donde no hay acceso a tratamiento, me dicen, María, gracias. Gracias por darnos la información, porque aunque no tengamos el acceso, eso nos da un incentivo para luchar contra nuestros gobiernos en Latinoamérica, para la comunidad Latinx, obviamente, y mostrar con lo que es lo científico y lo que es verídico luchar para que nos den el medicamento, porque cuando en realidad dar el medicamento es mucho menos costoso, porque si la persona se enferma les cuesta más. Entonces, al mostrar eso, es lo que estamos usando tal vez para que esos ignorantes cambien su mente y le den el acceso a medicamento a todas las personas en el mundo, porque como siempre hemos dicho, el derecho a la salud no es un privilegio, es un derecho humano. As I was saying, to end it now, and to be brand, as I said, treatment is a human right.
Yes, it is.
May
And
I
just like
add-
Maria
add,
talked about really quick about the studies. So there was the 05052 study, partner 1 study, partner 2 study, and opposites attract. You guys can look up those studies. There was 125,000 sex acts among those 4 studies, and there were 0 transmissions. I wanted to end with that.
Okay, hold on, how many? 100 what?
125,000.
Okay, just a minute. 58.
Davina,
Yes.
I like to, I follow the You Equals You team. I'm proud to belong to the ambassadors of the You Equals You. I want to share something that relates to what Maria said. And my first partner in New York, he died 18 years ago. And he died of HIV. And after joining You Equals You and listening on the messages, actually he didn't die with HIV. He died with stigma. He carried this HIV stigma for the longest, and I remember the conversations that we had many times, and he didn't want anybody to know. He was ashamed, and because of this, he didn't take the medication like he should have taken it, and this ended up in his death. Even when he was in the hospital, he didn't want anybody to know. So stigma kills. Stigma kills people, and You Equals You is a very powerful tool that we have to kill stigma. We need to do that.
It's very powerful.
Yes.
And when they say it's liberating, it is absolutely liberating. When you get people that come and ask you about it because they want to learn and find out if it's true. And you get people crying when they hear about You Equals You. You know, they get very emotional. So many people get emotional when they hear this message. It gets us emotional when people reach out with tears when they talk about You Equals You. It's not HIV that's killing people, it's the stigma. And You Equals You, like I said, it's totally changing the lives of people who live with HIV.
Exactly.
It really is.
May I add that in the Latinx community in Latin America, the stigma is even more horrible than the United States. And for example, for the first 10 years, my mother is here watching me. And I know she did it to protect me. She told me, we cannot tell no one that you have HIV. You have to say you have something that's similar. It's either going to be lupus or leukemia. And I said, okay, leukemia then. And then my family will be like, Maria, you have leukemia. How come your hair is so long and it doesn't fall? And I was like, well, because I take oral chemotherapy. The lies is horrible. And as we know, silence equals death. Your partner, for example.
Yes.
Many people die of complications of AIDS because of the stigma, and people never will know that it was. They'll think it was cancer or something. And that's very common in the Latinx community, very sad. And it's still happening to this day.
So in relation to the 40 years of HIV epidemic that we are all living since the 80s, right? What's the major change? What's the most important part of this campaign, of this You Equals You message that we can bring to the people living with HIV or people that are affected and infected by HIV? And because not only people living with HIV, but their lovers, partners, family, friends, who always go through this journey of diagnosis and treatment. Why is You Equals You so important after 40 years of the epidemic?
Because HIV has changed.
Mm-hmm.
It's showing that HIV has changed over 40 years. I was diagnosed 24 years ago. Just the fear and all the medication that we had to take, you know, being sick, taking your medications, having stomach aches and nausea, and it just didn't want to come out, you know, because you were so sick from taking these medications. But look now, people are taking 1 pill, some 2 a day. HIV has changed, and U equals U goes along with HIV has changed. You know, we can't continue to keep the same narrative that HIV is a death sentence, because it's not a death sentence anymore. And there are people that we all know that have lived 30, 35, close to 40 years with HIV AIDS, and they have. So yeah, the difference is HIV has changed over the years. It has changed, but we also have to remember that it's still going to be hard for healthcare providers to make this change. It's always hard to make a change mentally when you're so used to hearing the same thing. And an advocate that I know, Brian Jones, always says the same people that told us that we were infectious is now telling us that we aren't infectious. So if you believe in science, if they're healthcare providers, they believe in science, then they must believe in U equals U. They're doing a disservice to the community, to people who live with HIV, if they're not sharing U equals U with people who live with HIV.
It's unethical.
Yeah, they're doing a disservice.
And not only that, like I used to tell in the beginning, oh, you don't believe in U equals U? Then you cannot preach about TAS, treatment as prevention, because it's the same thing. If you're using treatment as prevention, it's basically the same thing as undetectable equals untransmittable. It's as simple as that.
Exactly. And that goes the message that everybody should take the treatment in order to be preventing himself to transmit the infection to other people.
I do want to add something else. I'm sorry, Lisa. I still don't want to minimize this condition, this human condition. As I always say, HIV AIDS is not a death sentence anymore, but it is a life sentence. And this goes because it's hard for us advocates, because I want to preach that this is a walk in the park and it's very easy and all of that. We go through things, okay? But it's not the same. So now let's push for a cure, you know, for the injectables. That's an awesome freaking thing. I cannot wait to try the injectable because I have pill burden. But that's another webinar about long-term survivors.
And also we have learned yesterday about vaccines, how science is advancing, right? How science goes to
Yes.
40 years ago when nobody knew what was causing this disease and people dying without having a diagnosis, to now, as we mentioning, people living healthier, longer, with U equals U, with PrEP, and preventing the new transmissions. And now soon we'll be able to have a vaccine to prevent infections anymore.
Right.
So talking about this very important moments in the 40 years of history of HIV. I remember, as I mentioned, the first diagnosis in 1981, right? And then it took a few years to find out what was the cause, the HIV virus, and then a way to diagnose it, the ELISA test. And then in 87, ACT, the first medication, and then in 96, all these new medications that changed the curve of HIV. And now forward to now that we have all these important tools that NLAAD promotes every year to the Latino community and to everybody that we can use, right? And we say in 2017, we can be superheroes.
Yeah.
We buy all these things that we have been promoting, and it's important. I personally love this message because you and I, from the very beginning, I took NLAAD, I included the message every year because it's important that the Latino community, as Maria says, we carry this stigma, this shame about being gay or about being HIV positive, about being, and knowing that U equals U exists, knowing that you are positive and you undetectable and you cannot transmit it to anybody, it carries this message that liberates you, as Davina says, from this stigma. Absolutely. So what's your comments on 40 years, Maria and Davina, of HIV and the changes that U equals U is making? And as Maria says, like, we have to tell everybody, right?
Everybody, we have to.
Yeah.
I don't see how anybody can talk about this. It makes you happy. I'm happy just being here. Every time I'm able to talk about U equals U, I just get so much. I tell people I get so much joy. It energizes me just to talk about it. And I won't stop talking about it. I will continue until the day I die. I will continue to talk about it because so many people with HIV they're scared. They're scared. And that fear is real when you're first diagnosed. And the health care providers need to be discussing this with people when they are first diagnosed with HIV. When they're first diagnosed. If all three of us had this message when we were first diagnosed, do you know how much that would have changed our lives and the people's lives around us that loved us? If we would have heard about this?
Oh my God.
Absolutely.
Amazing.
Yeah, it would have changed so much. But we have PrEP. We have U equals U. PrEP, prevention measure for people who are HIV negative. U equals U is the prevention measure for people who live with HIV. You can't talk about one and not talk about the other one.
That's right. And not only that, but if you want HIV to end, you could do all the campaigns that you want. We could speak everything that we want. But the reality is that HIV starts with us, people living with HIV. Because if we get tested, people are annually, like an annual exam, they find out that they have, HIV and they're living with it, they'll get on treatment. And for those that are already living with it, are here because of it, because they want to be undetectable, we stop HIV. HIV stops with me. I believe that that's the way that we're going to end HIV from the world. But for that, everyone has to know the information. And it's very sad that still many places around the world and in our countries and in the Latinx countries in Latin America and all over, some people still don't know what undetectable equals untransmittable is. Some people even ask me, what is HIV? What is VIH? What is HIV? Imagine, some people don't even know. That's the level of ignorance, or they think personally you could get it through the air, like COVID, for example.
It is very, for me especially, where I have worked in the medical community, right? So it's incredible for me that to find out that some people that I know that are doctors don't know about this message, don't know about PrEP, for example. It's incredible. Now I have to explain to them who are doctors. I mean, my past profession friends that studied with me, and I had to explain this to them. It's like, why isn't this being taught during medical school or during formation, right? In the different countries. This is very important. The medical schools around the world should teach this.
Around the world. I tell people when they tell me, well, the doctor won't listen to me. I said, write it down. Write down what Dr. Fauci said. Write down what Allison Rogers said. She was one of the leads in the partner study. Write it down. And write down what the CDC said, Lancet, write it all down and take it to them. They can't deny it. They know that it's there. A lot of them know that it's there.
They don't want to believe it. They want to continue making us feel like we're biohazard.
Sometimes we have to teach our physicians because there are some that don't know.
And I think it's important to tell people that if you want to learn, not only HIV and U equals U, about anything in the world, everything that is related to science, you have to follow science. And the organizations that are based on science, the CDC and the HHS and the World Health Organization, you cannot follow Facebook or WhatsApp or the friends or the neighbor or the person in the store. No, you have to follow science. Like, you cannot become with the president, our ex-president, right? That would be great.
Right. Well, people are believing in science when they take medication.
Exactly.
No, they're believing in science when they take a flu shot. I mean, so what is stopping them from believing in the science of U equals U?
I could tell you something about the Latinx community. They have always been they have not trusted really the medical community too much. Even before U equals U was found, I remember a lot of people from my culture saying, don't take those toxic medications. I've heard that they're poison and they're going to kill you. Because in the beginning, we had high dosages of AZT. I'm one of the ones that, like Dee said, in Colombia, we had no medicine. So when in 94 it came, it wasn't no protease inhibitor. It was AZT in high dosages. But I'm not talking about from the 80s. I'm talking about 94, 95. And it was Zerit, AZT. It was horrible. I remember as a teenager, I remember tasting my mouth like metal. I remember my veins felt burning my brain. And I told my mom that is here watching me. I said, Mom, I'm sorry, but I cannot take this because I feel like I'm dying when I take it. But when I don't take it, I feel healthy. I was a young teenager. Right. So you know, there's a lot of, they feel like, you know, the medical community is very sketchy. They don't want to believe. But Tom, look at your examples. Look at the long-term survivors that are doing well. You know, that's who you really have to follow. And obviously the recommendations of your doctor. But look at them. They take their medicine and look who's healthy, and unfortunately, who has passed on. The ones that are on treatment, the ones that didn't take their treatment. And that's
There's a question in the question and answer box, and she asked first about the number that represents undetectable for the message that we are carrying, right? We know that it's under 200. Person who reaches levels under 200 is undetectable for this message. So under 200, no transmission. But the medical terminology has changed because every time there is new lab tests that are more specific that detect lower and lower amounts of virus. So right now, like we say undetectable when it's under 40, I think, for the doctor. But for you, because you, it's under 200. Ana Maria del Rio Gonzalez, she's asking how we convey this information to, when and how we convey this information to patients that are living with HIV to let them understand that they are not untransmittable. Even the levels are higher than 40, but lower than 200. Who is in charge of doing this? Who should transmit this message to the persons?
it's a combination.
Who should give this message to the person as far as a patient and a physician?
The physician. Yes.
The physician, the advocates, the people that are living with
Everyone.
Yeah.
Like I said, as long as it's under 200 copies and below, my doctor tested 20 and below. Some doctors 50 and below. So it just depends on what your doctor tests for. But it's 200 copies and below.
Exactly.
I don't know. I tell people, everybody's not able. Me and Marie were talking about this one time. Everybody's not able to just go find another doctor, especially if you live in another country. But, you know, in the US, I tell people, find another physician because it's about your health and you have to advocate for your health. And if they don't want to listen to you, you fight for them to listen to you.
And this brings us to what I was saying before, right? Like even doctors don't know this, even doctors don't know about, because there are doctors that work with HIV and there are doctors that are dermatologists, neurologists, different types of doctors that they don't need to know all this because medicine is so big, so dense that we cannot know everything. So maybe a doctor who's all his life he's 74 years old now and he's all his life been treating children or taking care of skin disorders. Maybe he doesn't know about you because you. I mean,
Exactly.
he need wrong information. So, as Davina said, find a doctor that is more focused on HIV, who can have more information about the treatment and the outcome of the treatment, and who is younger and open
Or get the information yourself and take it to them.
Yes,
Take
and
it to
that's
them
what we
and
do
show
here.
them.
Like, and that's the reason why we have this webinar, and that's the reason why we carry this message everywhere. It's our obligation to carry this message to people.
Right.
Exactly. And obligation of everybody who knows this needs to transmit it to other people.
Yep, absolutely. I agree.
And as we're doing now with Davina, sharing the information, where information is coming from, right? Like it's not just we invented it, it came from the studies that were carried on around the world based on science. And there's no way to deny the results.
So I had somebody that said in advocacy, same person, Brian Jones, 1 + 1 = 2. You could take one person, the other person joins, that makes 2. But then you keep adding people into a certain message or advocacy message that you want to convey, and it can turn into something like U = U, which is now worldwide. It's a worldwide message. And it started with advocates. The message started with advocates yelling loud to get this message out because we knew that it was about the health and well-being of us. We knew that we had to know about our social, sexual, and reproductive health. The doctors weren't going to shout it. We were going to continue to keep shouting it. But the advocates joined. Then the scientists joined on. Then they created the consensus statement. And it went from there. And 5 years later, look where it's at. Look where it's at.
Yes. talking about that, and I also think that sometimes doctors or medical personnel think they have the right, because they're doctors, to not transmit information because they think that if I want to tell a kid, 16-year-old kid, that you can take PrEP or you consume message, he's going to become promiscuous or something like that,
Yeah.
right? And then they try to protect and protections this person from all these things, but in reality, if preventing this person to know about tools that can save his life or their life. So I don't think anybody should be judgmental of anything. Everybody's carry their life as they want it, and you can all give this advice and provide information, the right information that you can use to live longer and healthier. And because you're such an important part.
Yeah, it is. It really is. It's so important. It's so important for everybody to know. I just tell everybody here, learn more about U equals U. Go to the website, Prevention Access Campaign website. You can read. There's things that you can download and keep for yourself. Get familiar with the messaging of U equals U, so that when you're talking to someone and conveying the message of U equals U, it flows really easy, you know, and then they'll start to get it because you have confidence when you're talking about it. And they're going to say, oh, this person knows what they're talking about. And you tell them, go look it up. They'll look it up and it's there. So just keep yourself working on it, keep repeating, keep reading and learning more about U equals U.
Yeah.
And you're able to get that message out. Wear shirts. That's what I do. People ask me what does it mean, and I'm able to have that conversation. Even in the grocery store, people who are HIV negative, oh, what is that? You know, and then I'm able to tell them. I'm able to tell them what U equals U is, and they're in shock. I remember I met a couple who I buy T-shirts from, and they make a lot of U equals U messaging for me. And I remember them saying, I said, you guys never asked me what U equals U was. They said, oh, we looked it up.
And you still wearing mask? Wearing like this.
Yeah.
In the cap. And you know something, for the Latinx community, we have materials in Spanish. I'm also the global ambassador of the World Project. Look them up. They have all the slides and all the information translated in Spanish, which is very important. Tenemos, para los que no entienden inglés, yo soy embajadora global de una organización de mujeres nacional que se llama The World Project. Mírenme en los medios sociales María HIV Mejía y pueden ir al lugar en español en The World Project y mirar todos los diapositivos donde pueden hacer presentaciones o mirar todo lo que es la información de indetectable, equivalente, transmisible, y así pueden ustedes entender sobre este tema que es tan importante, porque yo sé que no todo el mundo habla inglés.
There's a comment here from Ernesto Garcia from Texas. He says, HIV education is still needed out in our local communities, especially communities greatly affected by high rates of new HIV diagnosis. What is basic information for us as professionals working in the field is no common knowledge for a person that has never researched HIV and STIs. The message of knowing your status is one that still applies. Many folks out there still do not get tested for HIV as they should, per sexual or other risk factors. U equals U is a great campaign, and I can't wait to integrate more into our current strategic approach towards ending the HIV epidemic in our local community in Austin, Texas. Thank you very much, Ernesto, for this comment.
Thank you. That's awesome.
Keep on working with all of us, carry the message of U equals U.
Somebody wanted to know, Anna, it's called the Well Project, thewellproject.org, and you can get information there in Spanish.
Yes, please.
Type it in the chat for you, okay? I'll put the link in the chat. Just give me a second.
I'm gonna put it to you.
And also, everybody, we at Latino Commission on AIDS, we have this campaign that we are doing right now, National Latino AIDS Awareness Day, National Latinx Awareness Day, in which we have messages in English and in Spanish. You can go to our webpage, www.nlaad.org, and which I'm going to write in the chat box soon, and where you can find information both in English and in Spanish, and you can share it with people that you know may need it. There's another question here. Oh, Garza, Ernesto Garza, pardon. Sorry.
Garza.
I'm trying to pull it up.
Okay, I'm writing now then. That's our website. It's only 5 minutes left to our hour that we have planned this webinar, and it was amazing to talk to you, Maria and Davina. And I think it's the first time I participate actively in the middle of the webinar, because I'm always moderating. I don't carry the message, but I have to say some things because I'm part of this team. I'm very proud, part of the You Ambassador team, and carry this message everywhere I go. Maybe I'm not presenting anywhere like Maria is doing, but I always talk to people, and I always tell these things. Especially during my campaign, NLAAD, and that's why I include every year a webinar of NLAAD because I think it's very important. Every year we have to remind people around the world that this message exists, that this campaign exists, that You is a tool that people living with HIV and people not living with HIV can use to stop this epidemic, as Maria says.
Yeah, thank you.
Any last message, all of you?
No, I want to say thank you to the Latino Commission on AIDS for having us here. Last year we did one, and again, thank you so much for letting us come here and share the message of You equals You with your community. But I just want to say, keep sharing, keep talking, keep speaking the message of You equals You, everyone, to everybody, HIV positive and HIV negative, because it is changing the lives of people who live with HIV.
And I wanted to say also, thank you very much to the Latino Commission on AIDS, to you, Luis. Un gran saludo a Guillermo Chacón, que tiene el mismo cumpleaños que yo, 11 de abril. Hug. And thank you also to Prevention Access Campaign, to Bruce, to Dee, to Cameron, for all of us ambassadors.
Right.
Right.
We're going to keep on being relentless, and pound it every day, the information every day. That's how it's going to be effective. We have to talk about it every day.
Every day.
Thank you.
Every day.
Thank you very much, Davina. Thank you very much, Mejia, for having presented this information to our audience in NLAAD. I'm very happy to have you here, and I will have you again next year. And my apologies, my excuses to everybody for the beginning. It was like the computers have their own mind; they do whatever they want without our permission. Mine just started updating, and I said, "Oh my god!" But anyway, thank you everybody for being with us today. It has been a pleasure to have You equals You as a message in our NLAAD campaign. And the next webinar that we have for NLAAD is going to be in November, and it's going to be presented by a very important person in the government of the United States. It's going to talk about the 40 years of the pandemic, the HIV epidemic in the United States, how we started and where we are now, including You equals You. So thank you, Maria and Davina, again.
Thank you.
Love you too, and I love You equals You. And see you everybody next time.
Thank you. It was good to see you, Luis. Thank you. Bye, everyone.
Bye. Bye.